Hello, everyone. My name is Erica Hill, and I'm going to be talking to you today about cystic fibrosis. So, cystic fibrosis is an inherited disease that's characterized by the buildup of thick, sticky mucus. It can damage the body's organs. The disorder is the common signs and symptoms include progressive damage, to the digestive and the respiratory system. As you can see right here, this is a normal airway, but when a person has cystic fibrosis, they start getting this mucus that causes a bacterial infection, which clogs the airways and prevents them from being able to breathe properly. Most people with CF have major problems with their digestive system. So the phenotypic features would be this buildup starts, the sticky mucus can start to build up in the pancreas, and it prevents the proper digestion of food. That can lead to diarrhea, malnutrition, and poor growth. Also, weight loss. So a person that has cystic fibrosis will tend to appear slim and malnourished, which can give off the appearance of them looking unhealthy. So the physical history and physical findings in a case study. So I researched on the Biomed Central, and in 2006 there was an article that was done, an adult cystic fibrosis patient presenting with dyspnea, and this is the case study report. Adult cystic fibrosis patients are growing in numbers as they are living into the ages with coronary artery disease, which coronary artery disease becomes prevalent. So in this study, there were two male cystic fibrosis patients. They were 52 years old. They both had symptoms of dyspnea, which is shortness of breath, and chest pain. They both were given the same test. They were given blood work. They were given chest x-rays. They were also given pulmonary function tests to test their lung functions. And also, they were treated both with antibiotic regimens. So the first patient did not respond to the antibiotics, whereas the second patient did respond to antibiotics, which indicated that he was possibly having a CF flare-up, whereas the first patient was actually affected by coronary artery disease. And so he had to start treatment for that. So in cystic fibrosis, when a patient is also presenting with dyspnea and chest pain, it's good to do further treatment to make sure that they're not in the beginning stages of coronary artery disease, because that is something that also can develop. The background of this disorder, CF is a recessive disorder that primarily affects the epithelial cell in the intestine, the respiratory system, the pancreas, the gallbladder, and sweat glands. So there are over 1,000 mutations identified with cystic fibrosis, and they've been broken down into these 5 characteristics or classes here. So when you think about that, 1,000 mutations is a lot when you're thinking about this gene. So they're broken down here in how they affect the human body. And the phenotypic nature and natural history, the mental behavior and characteristics, you can only imagine, or I can only imagine, how a person with this cystic fibrosis would feel. Trying to live a normal life with this disease, I'm sure it's tough. People that have this disease experience isolation, depression, frustration, sadness, anxiety, guilt, loneliness, and resentment, because they're fully aware of what's going on. There's nothing really wrong with them mentally. They're mostly affected physically. So to see everyone go on with a normal life and they have so many restrictions to their health, I'm sure that it works on them mentally. And for the management and cure options right now, there is no cure for CF. The only thing that has been known to help are medications, which again is mostly antibiotics, chest therapy, um, treatment that helps them to loosen up mucus in their airways, and also pulmonary rehab, which helps them to maintain and improve healthy lung functions. So the inherited risk of CF, you must get a copy of the CF gene from each parent. Each parent must at least be a carrier. So when both parents are carriers, there's a 25% chance that the child would have CF. But if one person or parent already has CF, and then the other one is a carrier, then there's a 50% chance that the child will have CF. So there's a higher risk when a parent already has CF as well. And lastly, the mega gene tree. So humans, as most of us all know, are very closely related to monkeys. So in carrying the CF gene, the crab-eating marquis monkey was about almost 98% genetically able as well to carry the CF gene, and it goes down to the European rabbit, then to cattle, then to the chimpanzee, then the green monkey, and the southern pig-tailed marquis, and the African bush elephant. So all of these species, we share the CF gene, which is very amazing. So I hope that this was helpful for you, and thanks for watching.